everybody, it's Faheem from Medlearn. In this video, we are going to start to look at a topic that is very dear to my heart because I have many patients and family friends who suffer with diabetes. In order for you as a healthcare professional, even as a patient, to manage this, understand this condition, there's certain things you have to really understand. In this video, we're talking about the etiology, so the cause, why it happens, and then we'll look at how the body responds to these changes. So we're also going to look at the pathology. So we'll look at the cause, what causes diabetes, and then what happens internally where the body has to make changes to adapt to a, let's say, diabetic state. So that's going to be important. First of all, I want to talk about normal. What is normal? So we have some, let's say for argument's sake, we have insulin here. This is insulin, okay? And what's going to happen is that insulin, understand this, is going to bind on to the insulin receptor. So think of it as this is a key and this is the lock. Insulin binds. When insulin binds on the receptor, we have some changes that occur here. This then allows another lock, the glucose lock, which basically means that the glucose can bind onto this receptor and enter the cell. So what you need to understand is this. In order for glucose, which is a molecule that we use for energy, for this to enter the cell, insulin has to be present. Now, this is not for every single cell in the body. For example, the brain does not require insulin. Because if the brain required insulin, then anybody who was diabetic would probably, would expire. So not every cell, but most cells, for example, we're talking about muscles and so on, they require this mechanism. So what happens is, insulin binds to the receptor, then glucose can bind to its receptor and enter the cell. Imagine if for some reason the insulin was to bind to the receptor, but the receptor was not working. The effects that happen downstream or inside the cell don't work. Then what would happen? Then glucose can't enter the cell. This could be because of insulin resistance. It could be that the insulin molecule that's trying to bind onto the receptor is not working. So we've got the key, there's the insulin, but it's not fitting into the lock. This is called insulin resistant. So that could be one reason why glucose can't enter the cell and we get high levels of glucose. Another reason could be that we're not producing enough insulin. So let's just say we're not producing enough keys to even enter the lock. So that's the two things you must remember in this video. If there's anything you take away, understand. In type 2 diabetes, not type 1. In type 2 diabetes, what we're having is either an issue with insulin resistance. So we've got the insulin, but it's not binding onto the receptor, it's not working, or we're not producing enough insulin. Two things. So what is the cause of type 2 diabetes? Simple. Number one, genetics. You may have a genetic predisposition. What that means is genetically, you are more likely to develop diabetes. And we're not going to get into that in this topic. For those of you folks who want to learn diabetes inside out, get in touch with us at Medlearn, whether you're a GP, you're a pharmacist, you're a nurse, and you want to develop your skills, or perhaps you want to create content with us, you can get in touch with that Medlearn. We can absolutely help you and develop your skills. So, etiology, the cause. What's happening here? Number one, what is the cause? What is the cause of insulin resistance or issues with secretion of insulin? Number one, genetics. Could be a genetic issue. Just genetically, there's some issues why you have one of these problems, or perhaps both. Or lifestyle. That is very important. And then your environment. For example, stress. You don't have control of your genetics. That's something you're born with. Having said that, we are looking at therapies where you can change your genetics now and amend the genetics. But as it stands, you have let's say this was a gun. You have the choice to shoot and use the bullets. What that means is, yes, you may have a genetic predisposition where you're at risk of diabetes, but it's your lifestyle and it's your environment that makes sure this happens. So if we look after your lifestyle and environment, there's less chance of this happening. Now, what I want to talk about and briefly introduce is the pathology. We now know the cause. It's either genetics, lifestyle, environment. What changes happen in the body such that we get to this position where either we're resistant to insulin or there's issues with insulin production. In the second video, I'll go through this in depth. But in this video, I just want to explain one thing to you. You should understand why we need to maintain a very, let's say, a range of glucose in the body. Try to understand this. What you need to understand so far is this. Number one, you now understand actually that the reason we're developing type 2 diabetes is because either the insulin that's binding onto the receptor is not working, is resistant, or we're not producing enough insulin. And that's because of genetics, lifestyle, environment. Now I'm explaining to you why this happens. How does your lifestyle, environment, we're not talking about genetics, how does your lifestyle, environment, mainly diet, lead to this? Before you get there, you must understand why we have to maintain a set range of glucose. Why do we have to have a set range of glucose? Number one, glucose is our, you can say, this is going to be the initial investment. This is the initial investment. We're going to invest this, and as a result, we get our energy to make ATP. ATP is your currency. This is what the cells need to work. They don't need pounds, they don't need dollars, they need ATP. In order to make ATP, we need to make an investment. So we take in some glucose, we break down the glucose, we release energy, and by releasing energy, we create ATP. If we've got too much energy, then what we can do is we can store this energy. That's what you need to understand. What happens if your levels of glucose are too low? Well, now you know if your levels are too low, guess what? You don't have the currency for your cells to do what they need to do. So you're going to feel tired. You're going to sweat. Your body's going to make all sorts of changes, but you don't have the energy that's required. Think of a time when your sugar levels drop, when you feel that you don't have the energy. So that's one problem, especially the brain. Very important. What if the levels are too high? So what? What happens if your levels are too high? Well, what ends up happening is, and I don't want to go into too much chemistry here, but what you need to understand is by having high levels of glucose in your body, we're going to have an excess of energy. Too much. This energy has to go somewhere. And what I mean in excess, I'm talking electrons. And we don't, again, I'm not going in too much chemistry. For those of you folks who really want to go in depth, we will go in depth. But just remember, having too much energy that's not stored is bad. And it's not actually energy we're talking about these molecules. N, A, D, H, and NAD+. We're talking about this here. But for now, I don't want to go into this depth. Just leave that for now. Just understand, okay, we've got too much glucose, we've got too much energy. We end up with the body having too much of something, and they end up damaging other parts of your body itself. Okay? They end up damaging other parts of your cells. So we call this oxidative stress. We have ROS. Okay, we have these species that are reactive because they've got too much energy, they want to bind with something, and we end up having various other molecules, AGEs, that are produced as well. And in the next video, we'll go in depth, but the key thing to remember is, if you have too much high glucose, if your glucose levels are too high, you're going to end up with your body being in a difficult state. In this video, I don't want to go into too much depth because it's going to confuse you, but just remember, too much glucose means stress on the body itself. Oxidative stress. We end up with molecules that are not happy anymore. For example, oxygen. Oxygen exists as O2. Two lots of oxygen for argument's sake. What if, and this is happy now, because it's sharing equal amount of electrons, it's happy, okay? What if we give it an extra electron? It's now become negatively charged. It's not going to be happy. No longer is it stable. It's not in a stable state. It needs to get rid of that charge. So it's going to bump into a friend and give it the charge. So you can imagine you having this domino effect. That was my point with these electrons, but I don't want to get into too much depth, and I'm doing it, and you folks are watching thinking you're saying no, but you're doing it. But what you need to understand is, this is what's happening. You're left with the molecules that are not happy, they're not stable anymore. They've got too much extra charge, so they have to get rid of the charge. Think of it as this, and I'll end it here. When you have too much charge, have you ever had that feeling when you touch someone, you get that bzzz, that electric? For those of you folks who are watching, think of that time when you touch, oh, I've got a shock, because the charge is not balanced. Same thing here, we don't have an equal charge. It's not balanced. It's going to try to get rid of that charge. To get rid of that charge, it's going to bump into other molecules and make them unhappy. And that's what we call oxidative stress. We've got reactive oxygen in these species who are just unhappy. And we also start causing damage to other parts of the body itself. So now you understand high levels of glucose is bad. Low level of glucose also bad. In the next video, we're going to find out when you have too much glucose, how we end up storing it as fat. And what happens when this fat gets stored in muscles, liver, pancreas. Guess what, folks? You're going to end up with insulin resistance and issues with secretion. I hope you found this video useful. Thank you for watching.